We're here at the Temple University Hospital, one of the largest healthcare institutions in the greater Philadelphia region, interviewing the new president of Temple University Hospital, Mr. John Kastanis. Please describe your role as a healthcare professional and as a leader in this one of the main healthcare institutions in the region, the Temple University Hospital.
Okay, well, as you know, I'm president and CEO right now of Temple University Hospital, and with that title comes a lot of responsibilities. It's not just the day-to-day leadership of the organization, guiding all the management teams, all the supervisory groups we have here, but the various professionals, starting with some very high-ranking physicians, nurses, allied health professionals. So that all falls under my purview. So on a day-to-day basis, this office really is ultimately responsible for the operations of the enterprise. But just as important as that aspect is the fact that in this industry, as most of you know, it's under a lot of change. Whether it's the Obama administration or anyone in Washington that's in the leadership role, healthcare now has become a primary focus and a major topic of discussions and issues. And from that, any hospital right now, particularly an academic medical center this size and scope, such as Temple, we really have to remain focused on strategies. This is an industry where we have a lot of changing phenomena. The medical research and discoveries, the technologies that are coming forward are something that we have to stay abreast of. We try to plan financially and operationally for the type of care we want to render to our patients, and we're always focused on the best, highest quality care, assuring patient safety and doing it in the most cost-effective manner possible. But we always are aware that the industry is always changing, regulatory-wise, politically, socially, but more so technologically. We have a lot of advances in medicine that have now changed the whole aspect of rendering care. We're seeing less patients needing to be admitted into a hospital. More, based on the new technologies, we have more need to provide care, intensive care too, a highly technologized care on an ambulatory basis. So that shift alone has really been redirecting the industry more and more. And we're going to have more what we call minimally invasive procedures, and the need for an acute care bed will diminish over time. We're going to have probably more and more need for much sicker patients to be admitted, and when you're running an academic medical center, again, like Temple, where we focus on what we call tertiary care and what we call quaternary care, the highest level, the most intense care, that will remain as a major component of an academic medical center. But we have to balance it all. And when you look at the trends in terms of trying to effect cost-effective care, improving the patient experience, and focusing on population health, these are the big trends that we're going to stay focused on, whether Obama's in the White House or Romney or anyone else. These are now the new trends. So we have to remain focused on the mission of an academic medical center, which is obviously training our future physicians. And in this particular location in North Philadelphia, we have a high concentration of low-income patients. A lot of them are on Medicaid. Some of them still are uninsured, but given their low-income status, we're able to get them some type of coverage, either through Medicaid or through some subsidization from the state of Pennsylvania. So that immediate mission, serving the immediate communities that surround this medical center, will remain a major part of our mission. But again, remaining focused on our mission as an academic medical center to provide high quality care, training future physicians, and also really being a part of research. Day to day, we treat a lot of patients here, but we have a lot of researchers here in a lot of different specialties: cardiovascular, pulmonary, thoracics, orthopedics, all the different specialties that we provide here in terms of direct patient care. There's a research component as well, while we're also teaching future doctors. So there's a big responsibility that comes with running Temple University Hospital on a day-to-day basis. And there are a lot of moving parts. There's a lot of things that we have to juggle day in and day out, but in essence, that's what I'm doing here in my leadership role right now.
What is the most important factor in healthcare process, Mr. President?
The most important?
Yes, factor in the healthcare process.
No matter, as a provider, whether you're running an academic medical center, a nursing home, a home care agency, if you're a healthcare provider, the number one objective is to provide high quality, safe care. Patient care is paramount. On a day-to-day basis, that's what we worry about more than anything else, is how are we rendering care in a safe way, high qualitative way, and given the economics of our industry, it has to be cost effective as well. So that's what keeps us awake at night.
Tell us a little bit of your background, since you're appealing to the Greek-American population in the tri-state area, not only in the tri-state area, East Coast and all over the United States, but to the younger generation as well. What kind of educational background have you had that prepared you for your current role as a leader in this institution?
It didn't come easy for me. I wasn't sure when I got out of college what I wanted to do. I thought I was going to go into law. I had an undergraduate degree, a baccalaureate in political science. I thought I was going to go into government. But fortunately, I got involved in upstate New York with another Greek-American best friend of mine who was a social worker. And he was running these drug and alcohol rehab programs in upstate New York. And he and I wrote a grant at the time, this was in the mid-70s, where he and I were noticing that there was a high recidivism rate of people who were getting behind the wheel, getting arrested for drunk driving, and winding up being the same offender in the same category. And we wrote a grant to the New York State Department of Motor Vehicles, and through the local prosecutor's office, we were audited for several years, and we ran a program that basically had the local DA's office refer first-time offenders for drunk driving to our program. Our program had a curriculum where we not only taught the basic elements of alcoholism, social drinking, and its negative impact on driving skills. We taught about the traffic system and the overall disease itself, alcoholism. We had screens in the curriculum to identify those that were real alcoholics versus just a social drinker that made the mistake of getting behind the wheel and driving under the influence. Long story short, the program was audited, and the New York State Legislature mandated that this program be offered to all first-time offenders in New York State, and it's still in effect. But those years you weren't offered a conditional driver's license to ride back and forth to work and go to school. They offer that now, but you know, I really started to learn a lot about the basic elements of our healthcare system. The program evolved where it was statewide. A lot of other states have mimicked the program. But during the course of being a counselor, I wound up taking over my friend's job. I became the county coordinator for all addiction services. And I got into more of a management role. I was watching the whole spectrum of care. We used to have patients or clients that really, from their alcoholism, would go into delirium tremens. We'd have them in the back of our cars, take them to the local emergency department, and I learned a lot about the healthcare system. And given my management experience year to date, I decided to go back and get my MBA in health administration.
Good.
So I took the time out full time, took out some loans, went to school full time, and that was probably the best thing I ever did, rather than going to school part time.
Investment.
Moved back to New York City and got the MBA and some relevant experience through a couple of administrative residencies. I was assigned to a couple of top CEOs in New York City at the time.
Beautiful. Mr. President, the goals and objectives for the upcoming year.
Pertinent to Temple University?
Yes.
Yeah, well, they're pretty formidable. This is, you know, really a first-class, world-class academic medical center, and it's gone through some rough spots. But our major goal is to make sure that this is a major destination point for tertiary and quaternary care in the Delaware Valley and also the Mid-Atlantic region. Not that we've kind of lost our luster, but we have new physician leaders here now that have been recruiting a lot of top specialists in all our different service lines. And just to give you an example, you know, back in 1984, this is started heart and lung transplants. And we just reactivated our heart and lung transplant program only this past January. And the Medicare program has already recertified our lung transplant program, and we're about to get our heart transplant program recertified.
Beautiful.
So, you know, there's just a lot of high-level type of patient care that we're trying to rebuild here. And we're very excited about some of the new physician leaders and specialists that we're bringing on board right now. There's like a whole new spirit of rejuvenation that's going on here right now in Temple University health system.
Beautiful. Can you describe some of the challenges you encounter in your role?
There are quite a few. I mean, when you have an emergency department as big as ours, processing over 80,000 patients from low-income neighborhoods.
During the year?
Throughout the course of a year. We have an additionally 18,000 pediatric visits as well. And during the course of any day, you know, we have a tremendous resource here. Our trauma team is one of the best rated in the area. And we have a lot of volume that can be very challenging, given some of the level of violence that we have in North Philadelphia. I would say that's one challenge. But right now, every hospital is in the same boat insofar as trying to provide high value with the highest level quality care at a cost-efficient level. And every third-party payer right now, starting with the government payers, Medicare and Medicaid, are making that a mandate. And the government's programs are really stipulating that through new reimbursement methodologies. They're now demanding higher value, and they're monitoring quality outcomes. They're monitoring the cost of care, and they're starting to discount our reimbursement more and more based on those elements. If we don't provide, or they don't have a sense that we are providing high value for the payments they're giving us, there are now inherent penalties that are going to be built into the reimbursement system. So that's something that is quite a challenge on any given day.
Because you need to take it into the consideration every day, yes,
yeah.
Of course. Now I'm going to get back to the Greek identity. Has your Hellenic identity helped guide you in any way?
I would think so. You know, as fellow Greek Americans, I think you can all appreciate the fact that our heritage is such that you know we're spiritual, we're religious, and from that I would say I've drawn a lot in terms of my sense of right and wrong, sense of family, work ethic in our culture is very high, especially the Greek Americans that have migrated to other countries, particularly the United States, where we have been very, very hardworking people. I think we've been, I think with some of our conservative bent on things, we've been big contributors in the local communities
Absolutely.
that we've settled in, and you know, that work ethic you know, runs strong in most Greek Americans.
You're referring to the Hellenistic principles that we embrace. Yes, right. Yes, thank you. How do you see the future of Hellenism? Not only in our region, but in America,
You know,
being a Greek American.
Yeah, you can't help but think about what's happening in the homeland. It's rather depressing to see our Greece going through the economic strife, and from it, when you read some of the daily coverage, you're seeing that it's Greek versus Greek lately, which is pretty discouraging. Most visitors to Greece are always talking about, through their tourism eyes, they always comment about how friendly Greeks are and how hospitable they are.
Correct. And
yet it's ironic now to see our culture kind of turning on itself. The desperation is coming through. So I'm very concerned about that. But I think those of us that have done well, those of us that have left, and looking at what's going on back in the homeland, so to speak, I think it's incumbent upon a lot of us to be supportive, not only financially, but in other ways as well. So in terms of the future of Hellenism, I think it goes strong in this country. When you look at all the different church groups and the different community groups, Greek American community groups that exist, I think we still have a strong ethnic base that, first and foremost, we're Americans.
Of course.
And those of us that are here, for the most part, have embraced that privilege of being in this country.
Correct.
And those of us that have been born here, I think we take great pride in being first and foremost Americans. But that tied to Hellenism and the Greek ethnic background will continue to be a source of pride.
Do you have any advice for our fellow young Hellenes that they're headed in the correct direction with the Hermes Young Professionals Initiative?
I would say stay true to your interests, as discouraging as your interest might be if you're trying to be a doctor or a lawyer or getting an MBA and going into Wall Street. If it's still discouraging and trying to make inroads in your respective interests or areas of professional pursuits, I'd just say stick with it. Even if there are digressions where you can't get into a school you want to get into, or you can't get the job you want, you just continue to be kind of stubborn about it. Digressions, I found, are really good. There's always a reason why you can't get to where you want to at a moment in time that you think you need to be there. Getting sidetracked and doing different things, but staying focused on who you want to be and what your true interests are, it'll come over time.
Mr. President, thank you very much, knowing that your busy schedule. Thank you very much for hosting us today in your office, and thank you for your for the interview that you allow us to feature in the next issue of the Hellenic News of America.